Welcome to familydoctor.expert. I'm Dr. Grant Blashki, and today I'm going to talk about the benefits and pitfalls of DrGoogle. Now, for those of you who don't know what DrGoogle is, it's where you quickly do an internet search of any physical symptoms or treatments or health issues that you might have and try and find some useful information. I was surprised to read that 1 in 20 searches on Google are now health related. And in some ways that may be a good thing. Information is power, and I think the balance between GPs and consumers has really shifted, and of course doctors aren't perfect, and so it's actually terrific if people can find some useful idea or get some sort of second opinion off the internet. Fantastic. The other thing that people do looking up health issues on the internet is seeking alternatives to traditional medicine, or sometimes seeking support from a chat group or a support group. And so there can be benefits, and there's no doubt that medicine is vast and doctors are fallible, and someone looking up issues about their health has a very strong interest in making sure nothing's missed, and sometimes find things too. But, here's my but I must admit, in general practice, the vast majority of people I've seen who've got really involved in looking up their health issue on the net, there's a risk that it feeds anxiety. I think we have something as emotional as a health problem. We tend to overestimate our risk. We tend to do what we call mental filtering, which is being very narrow and reading about a particular symptom and going, yes, that's me. And coupled that with catastrophizing and assuming the worst, this can cause a lot of anxiety for people. And so I do spend a bit of time with people more and more who come in with bits of paper or websites on their phone and concerned that they have some terrible illness. Now, the other problem can be the other way, is that people come up with the wrong diagnosis, and because they lack objectivity, they may underestimate their risk of a really serious problem, and so that's obviously an issue. Similarly, they may go down the wrong track of treatment and take something over the counter or take something that interacts with their current treatment, and so there can be unintended consequences. I guess the main issue is the quality of the information of the internet, and there is vast variability. Some of the information obviously is incorrect or out of date, and I think it's very important to think about the origin of the information. We know that there are people promoting health products, medications, pharmaceutical products who have a strong vested interest in presenting particular information about health issues, and this can be quite subtle too. There's a concept called disease mongering, which is where, if you like, some of the vested interests try and shift the threshold by which a disease is labelled to try and create more people who've got their disease that they can sell medications to. So that's all a bit conspiratorial, but I think it's a real issue as well. The other sort of vested interest that you'll pick up on the internet is you do get some people who've become fairly obsessed with their condition. They may have a mental health issue or just become obsessed with it, and will often devote an enormous amount of energy to putting out information that may or may not be congruent with the science. So when we talk about the scientific method, and I guess as doctors you hope that you're getting information and advice that is essentially based on science, and I guess the metaphor I always use is I wouldn't get on an aeroplane where the pilot go, look, we haven't really, this doesn't really fly according to engineering scientific principles, but I like the vibe of it, and I think the plane's probably going to be just great. I would prefer someone that bases their decisions on science, and I think as a medical profession we need to do that. So where we run into trouble is that the personal anecdote, no doubt, is extremely powerful. It's often very high in emotion, but may or may not be based on scientific rigour. So we try really hard with the scientific method to get rid of our own biases using what we call the randomised controlled trial. So that's basically a trial where we randomly select half the people to get a particular treatment and half the people to get a pretend treatment, and then have a look after the study and see if the actual treatment is any better. And these studies all get put together in what are called meta-analyses. And there's a very good organisation called the COCHRANE collaboration that specialises in putting together multiple randomised controlled studies, and you'll certainly get a scientifically rigorous answer by looking at the Cochrane collaboration. Now, one other objection I have to the online search is that I think it doesn't have the individual perspective. So we talk in medicine about what we call the biopsychosocial approach, which means we look at the biological factors, and then you may get some facts off the internet, but there are also very strong psychological and social factors and cultural factors. And so having a doctor that gets to know you and knows what your belief system is and what's normal in your community can be very helpful. So there's a few things that you can do if you're looking up stuff on the internet. There's a code called the Health on the Net code, which Family Doctor Expert subscribe to, and that requires a whole lot of checklists to be absolutely clear about what your process of sourcing information is, attributing the information, staying up to date, making sure that people who access your site have their privacy protected, so be absolutely clear you're not collecting information about them, and talking about who is assessing the quality of information. So if you find something interesting on the internet that you think's relevant to you, it's helpful if you can print up something or summarise it. Obviously, in general practice land, the doctor doesn't have hours to spend with you, but you can definitely raise a treatment or a diagnosis that you found online and talk to your doctor. Just a couple of comments. As usual, I think that these videos are not to be considered a replacement for normal GP care. There are a couple of options that you can access if you are concerned and you can't get to a doctor face-to-face. In Australia, we have the Nurse Online phone line, which I think is very good. And increasingly, we're starting to see online doctor video chats. Now, it's not clear how much they're going to cost in the long term and what are some of the issues of consulting a doctor on a video chat type scenario. So that may have to be a topic for another Family Doctor Expert talk. So I'll finish off with a couple of favourite websites that I like. In Australia, I like the Better Health channel. I think that's got really good information. And there's a good UK website called the NHS Choices, which is also good. If you want to go hunting around for research, you can look at the Cochrane collaboration that I mentioned. I guess the main problem with the research studies is they're often very technical and they may not answer your specific question that you want answered. Some of the international websites like the CDC, the Centre for Disease Control, or the World Health Organization also has some good information, especially for travel-related issues. So I wish you luck from familydoctor.expert and all the best.